Hello and welcome. My name is Matthew J. Greer, and today I'm going to be talking about the glomerular filtration rate, part of the urinary system. This is prepared for Biology 520, Concepts of Human Physiology 2, through Grand Canyon University. My professor is Dr. Sandra Barrera, and today's date is the 16th of February, 2022. This structure here on this slide is the glomerulus. We're going to jump into what it is and how it filters things out of blood, and how that rate is kind of the forces that determine that. So to start out with, what is glomerular anatomy? Where is the glomerulus? Well, all of the filtration processes of the urinary system are happening in the kidney, which is the functional unit of that is the nephron. This nephron here on this first image is this kind of smaller part here with the tubule and this kind of glomerulus here. This is the structure we're going to be looking at today. It's got a Bowman's capsule on it. It's got blood vessels coming into and out of the glomerulus. There is this very shorter, kind of wider arteriole here. We call the afferent arteriole. It is coming into this glomerulus. The glomerulus is this kind of cluster of blood vessels here. As blood is pushed through here, through the afferent arteriole, some stuff is filtered out into this kind of capsule here. We call the Bowman's capsule, this yellow part here. And then this fluid space goes down throughout the rest of the nephron and gets filtered. And things get reabsorbed out here, things get excreted out here. And then the part of blood that isn't going through this kind of capsule part goes back out this afferent arteriole. Now these are both arterioles. This one is much bigger than this one. This one's much smaller. This is to keep this kind of bundle in here highly pressurized. By having this high amount of pressure, we get to have filtration occur, which helps move substances from inside the blood into this Bowman's capsule to be filtered, and then some of it to be reabsorbed and some of it to be excreted outside of the body. So this whole structure is built for the process of filtration, and this is important to note. This is just one of many, many different parts of the different nephrons inside of one kidney, and they have two kidneys. So there are lots and lots of nephrons inside of the body, each one of them doing this exact same job. So the glomerular membrane is made of three main parts, and the kind of analogy for this is kind of a sieve or a colander. This is built to get things, to keep things inside of the blood that we want to keep in the blood, really big things like red blood vessels and albumin, the protein that kind of helps with blood pressure. These things aren't going to be able to escape the lumen of the capillary, this fluid portion of the capillary. They aren't going to be able to get into this Bowman space and then go down and be filtered. So this first part here, if we're inside of the blood here, and we're moving up, as these blue arrows are saying here, into the Bowman space, they have to go through the glomerular capillary wall, and this is this endothelium here. The kind of unique thing about this endothelium is these fenestrations that are here. These allow things to move outside of these endothelium through there. The kind of pressure that's pushing this is this filtration force. So large things like red blood cells aren't going to be able to make it through these very small fenestrations. Some of your plasma proteins are able to, but they bounce off of the second part, the basement membrane here. But the things that are going to get through here, that are going to be successful in moving inside, are going to be things like ions, like sodium, potassium, things like glucose. Those smaller things are going to be able to move up through there, through those fenestrations, through that basement membrane. And then the inner layer here, so we have the endothelium they have to get through this basement membrane here, which bounces off those large proteins like albumin. And then they have to get through this inner layer of the Bowman's capsules, through these filtration slits, and then these foot-like cells here, these podocytes, give a little bit more kind of filtration and sorting mechanism here. these smaller kind of slits here, and this whole process is built to keep things that are important in the blood, that keep blood volume and keep blood cells. We don't want to filter those out of the body. We want those to stay inside of the blood. So we're preventing these blood cells and these plasma proteins from entering the Bowman space and from being excreted outside of the body. So another kind of, let me erase these here for you. Way of looking at this is we have this very, very highly wrapped up space here, which is increasing pressure, increasing time that all of this blood is moving across here. These blood cells are unable to get through. These plasma proteins are unable to get through, but these small ions and sugar molecules are able to flow outside of these arterioles and into this filtrate. So the forces affecting glomerular filtration rate. The first is the glomerular capillary blood pressure, and it's these purple arrows here. The higher the blood pressure, the more force that this blood is going to come in here. The higher the force, the more filtration that is going to occur. These, our arteries are almost kind of leaky to ions and glucose and all of these things that we want to filter in the blood. So getting pushed with more force against these walls is going to help them move outside of the arteries and into this Bowman's capsule. So some things that slow down this process are things like the plasma colloid osmotic pressure, the second force here, which is these yellow ones. As we have more and more stuff, let's use, for example, sodium ions. As we have more and more sodium ions inside of this Bowman's space here, the concentration is going to go up. This osmotic dissolved particle concentration is going to go up. As that goes up, this water and these particles are going to want to go down their concentration gradient, which is back into the arterioles. They're going to want to go that way because that's the way that that pressure is driving. Until these move down this kind of collecting duct here, that pressure is going to be pushing back into these arterioles here. So this is something that's pushing back against this glomerular filtration rate. And the third force is going to be these Bowman's capsule hydrostatic pressure. So the same way, think of like a balloon. If you have a balloon, that water inside of that balloon is going to be pushing on the outside of that balloon, of a water balloon. This is what gives them that rigidity. It's what gives them that tension. The same thing with this, this glomerular capsule here, this hydrostatic pressure inside of there. It is going to be pushing back against that filtration, that hydrostatic pressure from the glomerulus. So these forces are kind of in balance, pushing against each other, pushing with or against filtration. The first one here, this glomerular capillary blood pressure, is the big one. It's pushing towards filtration, and these other two are pushing against filtration. However, this net force, the net filtration pressure, or the NFP here, is going to be in favor of filtration. Glomerular hydrostatic pressure is 55 millimeters of mercury, and it is bigger than both of these two added together. When we add together blood colloid osmotic pressure and this Bowman's capsule hydrostatic pressure, those are both combined 45 millimeters mercury. We still have 10 millimeters of mercury pressure going towards filtration, moving this stuff out of the bloodstream, down into the Bowman's capsule to be filtered. And then later, it is important to note here that the first part of this filtration rate, what we're talking about, and the focus of this video, we're filtering things out of this glomerulus. But further down the line here, we're going to reabsorb some stuff back into the bloodstream. We want to reabsorb our glucose, and we want to reabsorb the nutrients and ions that are important for life. And we want to get rid of or secrete the stuff that isn't what we want to keep in the blood. And whatever we want to keep at the end of it will go back through the renal vein, back up to the heart, get pumped back through the body, and start the process all over again. Whatever we don't want and whatever is filtered out in this end stage here will go as urinary excretion. And it'll be the stuff that's left over after filtration that wasn't reabsorbed. All right, next we're going to talk about anti-GBM or Goodpasture's disease. And anti-GBM stands for anti-glomerular basement membrane. And then this disease, the cause of this disease is autoimmune, in which both the basement membrane of the kidneys and the lungs are attacked by autoantibodies, so antibodies created by the body to fight the body. Now, these normally have this disease has a genetic component to it, but can occur as these individuals are triggered by some kind of stimulus. And this will start the development of those autoimmune antibodies. So things that can trigger this are things like inhalation of smoke from drugs, such as cocaine, infections, smoking, exposure to metal dust, or exposure to hydrocarbons. And what happens in the symptoms of these, because this is both a lung and kidney disease, we have anemia, we have coughing up blood as in the lungs. This basement membrane is bleeding and swollen and upset. We have hematuria, which is blood in the urine, usually a very pink, kind of light-colored blood. It also can have this glomerular nephritis, which is inflammation of the glomerulus and that structure. And that's what this picture is here from DeVries. In a normal nephron, we have this nice kind of clear, distinct boundary. We have these tissues that look healthy, and you can see that the edges and the borders of them are all clearly defined. This is the glomerulus here, with the blood coming in and leaving. And you have this Bowman's capsule, and all of these capillaries, these nice capillary bundles in here. And everything you can tell, you can see all the individual structures, and you can see that there's, not any kind of blending of the two of them. This is a very healthy looking normal nephron versus this glomerular nephritis, where we have all of this inflammation. This is now a very angry looking, swollen structure. Anytime you have swollen and inflammation, you have increased chance of bleeding. Inflammation also means increased pressure. You're getting more and more stuff. These borders are no longer quite as defined. This is what leads that ability for blood to leak into the urine there. Now, treatment for this, because you have these antibodies, we need to get rid of the antibodies. So the treatment for this is plasmapheresis. And in plasmapheresis, the blood is going to be drawn out of the body. It's going to be separated down to its plasma and cellular component. And then these cells are going to be returned back to the body. Now what this is going to do is this is going to get rid of those antibodies that are attacking these basement membranes. So patients that go through this will go through daily plasmapheresis to get rid of these antibodies until we no longer can detect these antibodies in the bloodstream. At this point in time, these symptoms will subside, and then the body will be allowed to return back to normal. There's a very low chance that remission will occur, but there is a slight chance. But that is the typical treatment to help out with Goodpasture's disease here, this anti-GBM. For this presentation, I used the following references. I used this one by DeVries about Goodpasture syndrome. It's a very interesting read, and I used the main part of the physiology and the anatomy for the nephron and for the glomerulus and for the different forces involved is from Sherwood, from the textbooks, from Celsus Systems. It's got a lot of good information in there. It goes deeper about control of like the afferent arteriole and how it can be either dilated or constricted down to help affect that glomerular filtration rate. It's a good read. I hope that you learned something about the glomerulus, you learned about glomerular filtration rate, and that you learned kind of what to look for when looking at Goodpasture syndrome. Thank you for watching, and have a great day.